So in addition to using ultrasound for injections, I know you can also use it for diagnostics as well. Can you explain when you would choose to use ultrasound versus MRI and what the pros and cons are of using one versus the other?
Yeah. Using it for diagnostics is helpful in several areas. Certain times ultrasound is better than MRI for certain structures. Certain times it's complementary and you can get more or different information than MRI. And other times MRI is going to be more helpful. In general, ultrasound gives you really good resolution of superficial structures, of superficial nerves, tendons, muscle. It can't see past bone or into the joint. And so if you need kind of a complete picture of the joint, MRI is going to be the best option for that. Ultrasound, you have a probe and you're looking at whatever is underneath the probe and you only see a credit card thin slice of whatever you're looking at. And so it's helpful if you kind of have a specific area where you think the pathology is going on, but if it's more diffuse, kind of entire hip region pain, an MRI might be more helpful because it gives you a larger field of view. Ultrasound's nice because it really doesn't have any side effects or risks. There's no radiation involved. I'm not injecting contrast or anything like that. MRI doesn't have radiation involved either. The other nice thing about ultrasound is I can do that in the office. You don't have to go to kind of a giant diagnostic center. It's generally more affordable than an MRI. And so all those things are things that I kind of consider as I'm evaluating a patient to say, all right, should we get an MRI? Should we do an ultrasound? Should we get the MRI and do a follow-up ultrasound or whatnot?